Okay, well, before we start, I just want to say thank you for letting us interview you.
Certainly.
We feel that your experience practicing ophthalmology will give us a little insight as to, into the little aspects of perspective and perception.
Okay.
So, what is your educational background and training?
I graduated from University of Pennsylvania, undergraduate, and got my medical degree at NYU School of Medicine. I did 2 years of general surgery at UCLA, and then did my ophthalmology training back at NYU, and did some subspecialty training in Boston.
How and why did you choose ophthalmology as a specialty?
That's kind of interesting. I originally started out in another field. It happens to be my uncle is a retinal surgeon on the West Coast, and I'd been exposed to ophthalmology since I was a kid. And I had two good friends in medical school who had changed their specialty training, and at that time I was thinking of some different things to do and spent time with my uncle out west, and decided to choose ophthalmology.
Throughout your career as an ophthalmologist, what is the most interesting thing that you've encountered about the eye and the vision it perceives?
Well, I think before we go into that, and I'm going to get to that, I think the first thing I'll make a couple discussions and just explain the parts about vision or about seeing and how it relates to perception. So here I brought a little model of the eye, which makes things a little easier. As we know, vision starts in the eye, obviously, but the real processing of it goes on in the brain. So it's kind of, the light is gathered by the eye, and it's formulated into signals, but the brain is what processes it and creates the image. And the easiest way to think of an eye is kind of like a camera, and I have a model here. So what you have, as I take the top off, is you have the light enters through the clear part of the eye, which is the cornea, and is then helped focus by a little piece of tissue here called the lens, just like the lens in a camera. And then it's focused onto the back of the eye, which is the retina. And the retina is really actually fine nerve fibers that are actually part of the brain. In fact, it's the only time you can actually see part of the brain without having to operate on a patient. And that it would be like the film in a camera, although nowadays with digital cameras there's no more film. But the retina takes the signals and creates these electrical signals and transmit it through a nerve, which is called the optic nerve, and that goes into the brain. And it's in the brain, usually what's called the visual cortex, which is in the back part of the brain, where all these transmitted signals are processed and create an image. And so the concepts of perception or perspective or vision are intertwined between the eye itself and the brain. And I may mention it as an example later, but the perfect example is that you can have a totally normal functioning eye and yet not be able to see. And it can change. And there's a disease called amblyopia. And sometimes the best way is to illustrate some of the things we'll talk about is not to talk about the normal, but the abnormal, so that you see in the absence of something what can happen. And a patient with amblyopia is somebody who, if you look at their eye and you study their eye, it's absolutely normal, yet they can't see. They can't see better than a vision of, say, 2200 or 2100, which we'll discuss. And the reason is that that part of their brain that processes that vision never got to develop. So, and the perfect example is if you've ever seen children when they're younger, they wear a patch on the eye or with the lazy eye. What happens is if they did studies, if you cover an eye from birth to about 9 years, and this wasn't done on humans, then the eye isn't seeing. And if you take that patch off and you see what kind of vision they have for the rest of their life, they don't have good vision. Whereas if you do that to an adult, it doesn't matter. And so what's happened is during that formative time, between the ages of 0 to 9, the eye is gathering all the information, sending it to the brain, and the brain is growing. And so that brain has to then develop, and it doesn't. So that's just something to understand about processing. Regarding in my career in ophthalmology, the only interesting I think I remember as a resident, there was a disease we were studying where the nerve, which sends all the signals to the brain, was damaged. But it was damaged not because the patient had some direct injury to the eye. They actually had fallen and hit their brow, and all of a sudden they couldn't see. And it's something we call traumatic optic neuropathy. And it was actually damage to the nerve, and the nerve being part of the brain, it doesn't usually fix itself. And so there had been some experimental work done at that time. And so we were in the emergency room. We weren't really sure what to do. This was a guy who was totally healthy. He had fallen off of a ladder, had banged his forehead, and was now blind. And so we instituted some measures which we felt were somewhat experimental at the time, but we didn't know much else to do. And amazingly, I would say within 12 to 24 hours, his vision returned. So it was pretty impressive, and it's one of the things I remember from training.
What is considered good vision?
Good vision is considered 20/20, which which means that it's too tough to explain. It's the minutes of arc, but it's 20/20 is considered normal vision.
How wide can a person's field of vision be?
Okay, so field of vision is measured in degrees, and if you look this way, it's about 100 degrees. This way, it's about 60 degrees if we're looking at this eye here. Up here, it's about 60, and down here, 75. The question is, do you know why it's 100 out here and only 60 this way?
Is the rest your blind spot?
Well, it's not as much that, but your nose gets in the way. So if you're in this eye, looking, you can see you have nothing blocking you because your vision, your field of vision is your peripheral vision. You're looking straight ahead and you see things moving. So you have much better field of vision out here than you do in this eye over here.